Okay, Simone here sprained her ankle. Simone, how'd you sprain your ankle?
I was going downhill in high heels, and I had a hole in the ground, so I didn't see it, and I flipped my foot inward.
Okay, and you say this is the first time you've sprained your ankle?
Yes,
So
first time.
we did another video last week about a very well-known playwright that a well-known person in Broadway, that elderly man that fell and forgot to tell me a week before coming in and forgot about that. So, you know, it's possible she did sprain it 2 times. Maybe? No?
It may be. I don't remember,
Okay.
honestly, but
So the reason I'm going into that is once you sprain your ankle twice, there is an inherent weakness in your ankle. Understand that. If you sprain that same ankle twice, there's an inherent weakness in that ankle. Okay? So we're going to heal up the soft tissue with this cold laser, but ultimately you're going to, if you have done it twice or if you do it again to this ankle, you're going to have to do some rehab. Luckily, it's a low ankle sprain. So she had a little bit of bruising right below the malleolus, the lateral malleolus, the outside of the ankle, a little bit of bruising underneath it. So, not a severe, it's a grade 1 most likely. She had x-rays done, no fracture. At this point, we're just healing up the soft tissue with this cold laser. That can do that really the quickest. There's nothing that can match that. So she's already had we've done 1 session or 2?
1 session, yeah.
Okay.
And before that, I had taken anti-inflammatories, but that didn't help at all.
Okay, and how are you doing now? I guess we're, a couple days in, right?
Right. So I did what you told me to, better support it,
Okay.
and I'm trying not to, and I'm wearing the sneakers instead of flats, and so it has kept it. It didn't get worse.
Okay.
But I also haven't been on my feet for a long time. It usually
Okay.
gets worse when I get on my feet.
Okay, so we need to get as many laser sessions in as we can here to speed up this healing process. That's what it does. It just speeds up the healing process of soft tissue and over fractures. It can stimulate osteoblastic activity, which helps to build bone, for those of you that don't know, but we're not trying to stimulate that today. So, luckily it's a low ankle sprain. So sometimes you'll see football players, they'll have a couple low ankle sprains. They tape their ankle and then they get a high ankle sprain, and that's worse. It takes longer to get over. I've had them, low and high. So we are going to prevent that, right, by just healing this soft tissue. But I want you to wear sneakers with support if you have not high heels. If you have sneakers with a high top, that would be better, something that gives you support if you don't have your AC bandage.
Okay.
But we're going to bandage up your ankle with an AC bandage if we have one here. Okay. So right here in this spot, this helps with lymph drainage. This is a nice spot to open up, reduce swelling right here in front of the malleolus, just above it. So there are a few specific spots. If we have a rental laser, then it's certainly worth
Getting it. Yeah.
asking Sarit and seeing if there's one there. I think there was one there, or somebody brought one back late yesterday. So.
Oh, okay. Great.
Okay.
Yeah. Thank you.
But you got to bring it back,
Of course.
You got to schedule the return, basically, with her. That's basically it. Do you have any ankle pain? Or is it just after a long day, that's it?
No, it's not a constant pain, but if I move it, it hurts.
Laterally?
Laterally, yeah. Like I can do this, but this is not okay.
Okay.
This is okay.
Okay. So we're there is a potential for us to send her out for an MRI if this doesn't improve in a week or 2. We're going to do about 4 to 5 minimum laser sessions in a week, and see how you respond. If you rent the laser, you'll get more than that, and
Yeah.
you'll just get through it faster. That's all.
Awesome.
Okay. So the next, if you were to rent the laser, I would say in another day or two, you would start with program 3. In another day or two, you would switch to program 2, which is going to target the tendons and the ligaments more. Okay?
Okay.
But we want to reduce the inflammation first with program 3. Go to program 2 in about 2 days, or after the pain's down significantly when you tilt laterally, right? Then switch it again to program 2, and do that for a few days, and then program 1 for the last day or two. So
Okay.
would benefit you to take it for close
That'd
to
be
a
great.
week.
I have to go. I'm traveling for work tomorrow,
Okay.
and on Monday I'll be on my feet all day. So it will be very helpful if I can rent it.
Are you going to be able to carry it with you with all that
Yeah.
equipment? Don't
Yeah.
lose it. Okay.
No, of course not.
They're expensive, but
Exactly.
ask Sarit if we have one, and then
Yeah, I'll schedule it.
Okay.
Because I'm going on Sunday, coming back on Tuesday. So it's a
You
quick-
won't need to do up here, but so this one can find inflammation just by scanning. The rentals, you cannot do that. Sorry, we don't rent this one out, but there we go. A little bit of inflammation there. So that's what's great about this laser, the Active Pro with STIM. It uses an impedance meter to find areas of soft tissue inflammation and damage. Really unique laser and very accurate. Actually, I think we used it once, maybe on your wrist or your elbow.
Yeah,
Yeah,
my
she's had. By the way, she works in film and television here in New York City. Works on all sorts of television sets and film sets as well. So her job is just probably moving around equipment, cameras. Just
Yeah, it's not as glamorous as everybody thinks. It's a lot of hard work, a lot of carrying weight. Yeah.
I used to kind of be in the very lowest levels when I was a kid, when I was younger out of school in that industry. So I know what goes on, and I was a film and television major in undergrad, but that's pretty neat though. You can see that, and then it doses that area. So I want you to straighten your legs here. Just want to check something here. We're not going to adjust your ankle yet, especially because we don't know if there's any torn ligaments or anything like that. So, okay. Now I want you to stand on it, the Achilles. Okay.
Yeah.
So let's sit here and switch. We're going to go. The Achilles it's a really thick tendon. So the Achilles is difficult. So this is one of the things that helped me stumble onto lasers. I had 2 partial tears of my Achilles. I did the Ironman in 2012, and in the middle, towards the end of the marathon, I had somebody fell in front of me, and I had to stop short. And then it was right after I'd climbed some stairs. So it was just, I felt a little pop, and at the time I didn't know what it was, but it was a partial tear. And then I did a triathlon the next weekend, and that's when I did the second tear. So the laser was my best friend. Achilles tendon is difficult. Let's not injure your Achilles. Bring your ankle up like that, the affected. Yep. And we're going to, don't look at that light. You can put these on. And you see the timer there?
Mm-hmm.
You're going to keep it there for a minute. You're going to go up here for a minute, and then you're going to go from this side for a minute, okay?
Okay.
The Achilles is the thickest tendon in this area for sure. Thickest tendon in the body, and it's difficult. So you want to make sure you're penetrating all the way into the tissue, and this isn't going to go all the way in through the tendon. This is going to get more to the surface, and then we'll go deeper with the laser in the next few sessions, okay?
Understood.
Okay, now we're going to go underneath. I did this side of it already, but I could see there is a little black and blue there.
Yeah, I didn't realize before. I think the pain from the other side was masking this one.
Yeah, I
and
did
now
the
that it's getting better, I
outside.
felt it.
I did the outside actually. And you're just gonna hold it there. It's super easy. It's a super pulse laser. So you don't need to look at the light, but it's a super pulse laser, so it's really easy. The treatments, even the rentals are like that. The rentals, the difference is this, you're holding it for a minute. That rental, you'll have to hold it in that spot for 2.5 minutes.
No worries.
This is a 50 watt, 50. That's, the rentals are 15 watt. So just longer treatment times, that's all.
Okay. 2.5 minutes is fast enough.
So when that goes down in another 10 seconds, press the yellow button. You'll leave it right here.
Copy that.
And thanks for tuning in. If you guys are interested in laser therapy, or if you sprain any ankles or any soft tissue injuries, cold laser's the way to go. She's had many cold laser treatments. She'll get that ankle adjusted eventually. We'll show you that maybe too.
Thank you.